Services Committee to order and ask that you stand and join me in the pledge to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. First up on the agenda is public health.
Morning. I have before you, I should have three resolutions. One is to apply for a 5-year grant for WIC, which we've had for 20 years in Essex County, and we've reapplied for 5 years.
Would somebody like to move that? Moved by Mr. Merrihew, seconded by Mr. Harrington. Any discussion on it? All in favor? Aye. Opposed? Carried.
I have two PAC, which is our Professional Advisory Committee. That is meets Dr. McKeever is the medical director for our program. He oversees the prevention side as well as the CHA. We have two resolutions. One is to adopt the policies and procedures of the PAC. We do this every single time, 4 times a year. And they've all been approved by PAC and approved by Dr. McKeever, so I need a resolution to approve them by the board.
Somebody move that, please. Moved by Mr. Harrington. Do we have a second? Mr. Merrihew. Discussion? All in favor? Aye. Opposed? Carried.
The other resolution I have is, if you remember Kathy Daggett, she worked for Essex County for many years as a public health nurse, as a CHA nurse, as the Director of Preventive Services, and as well as the Director of Public Health just before me. She has agreed to come back and sit on our Professional Advisory Council as a citizen member, and I need a motion to accept her or approve her as a member of our PAC.
Moved by Mr. Preston, seconded by Mr. Harrington. Discussion? All in favor? Aye. Opposed? Carried.
Okay.
Anything else?
Yes, I have a few things. The other thing I wanted to say, it's Movember, Men's Health Month. That's my, wait, have another. Wait. Movember is Men's Health Month, and I want you all to be cognizant of that and prostate cancer and all of the other cancers that you can have. We will be out at Rite Aid in Ticonderoga and Kinney Drugs in Lake Placid at E-Town. All of our staff will be wearing mustaches, so that is November. Oh, I thought that was... Also, I just wanted to mention that we had a Narcan training that was extremely successful. Narcan is the opiate reversal Canadian Food Plates was there. Thank you for it. Just to give you an idea, Fletcher Allen used it 625 times in the past year. They're averaging...
Something with that microphone.
They're averaging 6 times a month.
Controlling what
I don't know.
That's because that's
Okay. I can do it like this. Anyway, the other thing I just wanted to make you aware of that we had is creating healthy places, which you know we use for community gardens, playgrounds, trails, complete streets, farmers markets, and we have that extended for 6 months. So we're thrilled to have gotten that from the state. Also, I've sent you regular updates on Ebola. I wanted to extend my thanks to Patty Bashaw for getting the EMTs trained, as well as Elizabethtown and Ticonderoga Hospital that did a phenomenal job in getting us all ready and prepared if in case anything happens in Essex County. So thank you to them. And that's the end of my report.
Any questions for public health?
Yes.
Mr. Douglas first, then Mr. Harrington.
I just want to comment on Linda. You know, a lot of work behind the scenes. This Ebola outbreak throughout the world and possibly entering anywhere. And Linda's been way up in front. And I was in on a conference call once with it. You have done a great job all the way from the rules and regulations that are coming out of Washington, then out of the state. And I've watched you, and I've seen you be involved in all these things, and you're out in the forefront being well prepared, and I congratulate you for that, to make sure that we're all safe. Thank you.
Absolutely. Thank you very much.
Mr. Harrington.
Are other chain drugstores readying to follow CVS in not selling tobacco products?
That's a great question. There's a task force for tobacco prevention that's actually held out of Clinton County, and we partner in that grant, and they're looking at that. We do as much as even signage. I don't know if you ever noticed the Dollar Generals, when they open, they put these big banners out that say tobacco for sale here cheap, huge. So we've worked to get them removed. No, they're getting a lot of legislative pressure, as well as there's a national association, which has probably had a lot of impact on McKinney's and those drugstores. National Association for Public Health Officials, which I'm a member of. They fight in Washington and legislate and lobby. And I really think that that's probably where that battle's won. So.
Anything else for public health? Mr. Murphy.
Just for my benefit, the flu season, is that still an ongoing thing?
Oh my gosh, yes. So we just finished up all of our clinics. They were successful. We've been to, I don't have the list in front of me, but all of the folks, I should tell you that we are almost out of flu vaccine. We had it on back order, but we got it out early, and most of the drugstores and nobody had it, so we got hit really hard. We have a double clinic going on today. Also, interesting enough, public health has something called quadrivalent. What you get at most of your doctor's offices and at every other pharmacy is trivalent, which takes care of 3 strains. We ordered in the 4th strain. So if you get a shot with us, you'll have 4 of those flu possibilities covered. But yes, it's ongoing, and we will get more flu vaccine. But today, I'm looking to be really low.
Any other questions? If not, thank you. Next up on the agenda is Office of the Aging, Patty Bajow. Good morning, Patty.
Can you hear me? All right. So I just have 2 things. One's a resolution. We received supplemental 3B funding, which is basically money is really flexible. So you'll see on the appropriations and revenues, particularly the appropriations, we just basically put it in areas where we're getting kind of tight to cover that. Otherwise, so I'm looking for a resolution to receive $1,613 from 3B funding.
Moved by Mr. Skozavala, seconded by Mr. Politi. Discussion? If not, all in favor? Aye. Opposed? Carried.
Okay, and then an additional thing, I just want to remind everybody, Medicare D is currently open. We're seeing a huge walk-in to our office and also out in the community. So if you have anybody who's having high co-pays with their medicines, please refer them to us so that we can see if we can get them into a new plan.
Any questions for Patty?
And then just the last thing, I want to wish everybody a happy Veterans Day tomorrow for those who have served and who are serving.
Thank you. Transportation is next. Good morning, Nancy.
Good morning. I do have a resolution. I've accounted for the money a couple of times, well, in 2014 budget and again in 2015 budget. I guess the resolution that I previously had done didn't actually account for this supplemental part for DOT. So it's not anything additional. It's just, I guess, a mistake was made in the total amount of the previous funding.
Would somebody like to move that? Moved by Mr. Politi, seconded by Mr. Merrigan. Discussion? No discussion, all in favor? Aye. Opposed? Carried.
Any other questions?
Anything else, Nancy?
No, that's all
Any
for me.
questions for transportation? Mr. Marnell?
Yeah, I don't have a question, but it appears that
bus system going from Lake D-Town is, people are happy with it?
Yes, we have we have a cheerleader in the back, and we're averaging, I think it's 9 riders a day right now.
As far as Lynn, private working, that works out.
It's working really well. We do have one person that drives 1 day a week just to keep her hours down.
Anything else? If not, thank you.
Thank you.
Steve Valley has been excused. Next up is Social Services. Mr. O'Neill.
Yes. Good morning. Doing fine, thank you. I have a resolution. Actually, maybe 2 resolutions. One is for increase in appropriations and revenues, and appropriations and revenues for $56,097 for child care block grant.
Somebody like to move that, Mr. Fleety? Mr. Skozafa seconds it. Discussion? All in favor? Aye. Opposed? Carried.
The second one is I guess a little starting off with an apology, because I know the board wants to make sure you have information ahead of time, and this just came to me, so you choose what you want to do with it. It is basically a resolution, though, for a clerical but adjustment. Okay, so there was a resolution passed in April that incorrectly said we needed a budget amendment of $20,355 to the 2014 budget. And our fiscal manager and treasurer, deputy treasurer, discussed this with Judy, and Judy was discussing with Dan. We just want to make a clear adjustment to that resolution. So I'll read it and decide what we want to do. Resolution authorizing the budget amendment to the Social Services Department pursuant to Resolution number 79 of April 7, 2014, decreasing revenues and appropriations in the amount of $20,355 each smart New York funds, as it was inadvertently increased in the 2014 budget.
Yeah, okay. Here's what happens on these, and this was actually 2013 funds. At the end of 2013, you passed a resolution that provides that Linda can balance all the budget accounts, and so she made that adjustment already. The resolution that occurred in 2014 simply did it the second time, which is not permissible. So what this resolution represents is a reverse journal entry to correct the second resolution.
Moved by Mr. Fleety, seconded by Mr. Merryle. Discussion? All in favor? Aye. Opposed? Carried. Anything else, John?
Yes, one more thing. This whole expression probably out of Newcomb, I don't know where it came from, but don't blow your own horn. Somebody else use it as a spittoon.
I never heard that.
Never heard that. So I'd like to probably a little bit and say that in the medical transportation that Nancy has had to pick up some weeks, she had a vehicle that is causing a problem. She asked if we might have an extra one from surplus, and we do. We have a roadworthy vehicle we can surplus at this point. We're going to do that to Nancy, so thank you very much. That's all I have to say.
Any questions for Mr. O'Neill?
When he says roadworthy, he means it's got 130,000, but it's still running. 109,000.
Thank you, John. Anything else for Human Services? If not,